everyone. Welcome to Every Artist Insured, Getting and Keeping Affordable Health Insurance During a Pandemic. My name is Renata Marinero. I'm National Director of Health Services for the Actors Fund. I'm a social worker and have worked in different healthcare settings, including hospitals and rehabs, before coming to the Actors Fund. So I've seen how the healthcare system works and how it doesn't always work so great for the consumer. Our goal at Health Services is to create educated healthcare consumers. This is a for-profit system, in case you haven't noticed, and the best way to approach it is as an educated consumer. So in terms of this webinar, we're going to start by reviewing some basic vocabulary, since it's important for us all to understand the language of health insurance. Then we're going to move on to some basic regulations, so you know what your rights are. We'll move into how to estimate your income in the middle of this webinar, and we're going to talk about that in great detail. Then we'll discuss programs like Medicaid, the Essential Plan, and Affordable Care Act plans. We will not discuss Medicare during this presentation. Towards the end, we'll talk about how to pick a plan. And at the very end, we'll talk about where to get care and discounted medications if you're uninsured. We'll wrap up with a little bit of info on COVID-19 costs. Okay, let's get started. A little bit about the Actors Fund. You can find us at actorsfund.org. That's actorsfund.org. We have 4 main service areas. Social services helps with financial assistance, counseling, and support, and provides online groups around topics such as financial wellness. By the way, there's a weekly financial wellness webinar that goes over unemployment benefits, among other things. So if you're still struggling with getting unemployment, you might want to attend that. All of our webinars can be found at actorsfund.org/workshops. That's actorsfund.org/workshops. Career Services helps people find meaningful sideline work. Right now, they are offering a lot of COVID-19 related webinars on topics such as how to job search during a pandemic, as well as their other regular webinars like how to use LinkedIn. Health Services helps people understand and navigate the health insurance system. We provide weekly webinars like this, create educational materials, counsel you individually on what your options are, and help you enroll in insurance. We also provide direct primary and specialty care at our health center in Midtown Manhattan. Housing operates several affordable housing residences in New York and LA. We also offer resources to help you learn more about affordable housing opportunities and other housing related issues. All of our services are free. All right, let's talk about vocabulary. These are important words to know. A premium is essentially a subscription to your insurance. It's what you pay every month or sometimes quarterly, or if you're a student, maybe every semester, just to have insurance. A deductible is what you pay up front before your coverage kicks in. It's essentially the insurance company shifting costs onto the consumer. So if you have a $500 deductible and you go to a dermatologist and the dermatologist charges $250, you're paying that $250. And then if the dermatologist says, you know what, we're gonna need some lab work on this, and the lab charges, let's say $150, you're paying that $150. And then the derm says, you know what, you need some cream for that. And you go to the pharmacy and the pharmacy tells you it's going to be $100. You're paying that $100. Now you've paid $500 out of your own pocket for various medical expenses. And your deductible was $500. So you've met your deductible. That's what it's called, meeting your deductible. Now, when you go back to the doctor for a follow-up appointment, you're not going to have to pay those rates. You're going to be paying either copay or co-insurance. Copay is a flat fee. So sometimes you'll see it on your insurance card and it'll say copay $20 for your primary care physician or $40 for a specialist. It's a flat fee. Co-insurance is a percentage of the bill. So it might say 20% or 30%. That's your portion. That's what you pay when you go see the doctor or receive some kind of medical service. Coinsurance is always or almost always more expensive than a copay because coinsurance accurately reflects medical costs, and they are bananas, as we all know, right? So copays are generally cheaper than coinsurance. Your out-of-pocket maximum is a very important number. This was instituted by the Affordable Care Act. And basically, your out-of-pocket maximum is the most that you'll pay in a year for medical services under your insurance plan. Right now, in 2020, the federally mandated out-of-pocket maximum is $8,150. So you're not going to pay more than that if you're insured for medical expenses if you follow the rules of your policy, right? What that means is that once you get to $8,150 out of your own pocket, and that would include your deductible and any copays or coinsurance, but it does not include your premium, then you don't owe anything after that. There are lower out-of-pocket maximums. That's just the maximum out-of-pocket maximum for one person. In-network and out-of-network refers to networks of providers. Providers are doctors, hospitals, labs, pharmacies, etc. So if you have a plan that only lets you go in-network, you probably have an HMO or an EPO. Those are plans where you can only go to a network of doctors. If you go to that network of doctors or providers, then the insurance will cover you. If you don't, and you go to somebody that doesn't take your insurance, the insurance company will not cover you. Out-of-network plans are generally PPO or sometimes POS plans. And in those situations, you can go either in or out of network. That means you can go to the list of doctors that they have, or you can choose somebody that is not on that list or maybe doesn't even accept insurance. And in that situation, the insurance company is going to reimburse you a percentage of what you paid. So you generally pay up front, and then the insurance company reimburses you maybe 50, 60, or 70% of the cost of your visit. So PPOs allow you more freedom. They allow you the freedom to see more doctors. They allow you the freedom to travel, but they're more expensive. Marketplace or exchange, those two things are interchangeable. It's a website that you go to. The federal website is healthcare.gov, and that's where you go, and you'll be directed to your state marketplace or exchange at that website. That's where you go and you put in information about yourself, including your household information, your income, and then the system tells you what kind of health insurance programs you're eligible for. It will tell you whether you're eligible for perhaps Medicaid or a subsidy to buy health insurance. So it's a website, it's not a place, and they take your income into account when offering you different programs. The advanced premium tax credit is exactly that. It's a tax credit that you get in advance to pay your premiums. So it lowers your premiums. It's also known as the subsidy, and we'll talk about it more later. But basically what it does is it lowers the cost of your monthly premiums if you're eligible for it. And you can only get the subsidy if you go through the marketplace or exchange. Let's talk about current regulations so you know what your rights are. So these regulations were all instituted by the Affordable Care Act. Insurers cannot refuse coverage to anyone or exclude pre-existing conditions. They cannot impose annual or lifetime dollar limits. For example, they can't say, you know what, once we have paid $1 million for you, we're not paying anything after that. There is no longer a limit on what the insurance companies can pay. There is a limit on what you pay, and that's your out-of-pocket maximum. All marketplace plans must cover 10 essential benefits, and we'll talk about those more later. There's no federal penalty for being uninsured anymore, but there are some states that have penalties for being uninsured. So the states are California, Washington, D.C., Massachusetts, New Jersey, Rhode Island, and Vermont. In most of those states, the penalty is $695 or 2.5% of your income, whichever is greater. But if you do not live in one of these states, you do not have a penalty for being uninsured. Most insurance plans have to cover preventive services for free, and that includes mammograms, colonoscopies, pap smears, blood pressure, diabetes, and cholesterol tests, vaccines, fingers crossed for a COVID vaccine one day, immunizations, flu shots, HIV, and STD testing. There are other preventive screenings that are free if you're insured. You can find them at healthcare.gov. So if you're losing your insurance now or in the near future, you're probably asking yourself, what are my options? So you have the option, if you're losing your insurance through a job or your union, to get COBRA. And I'm going to talk about that in a second. You can also buy insurance directly from an insurance company. I don't necessarily recommend that because the insurance company will not take your income into account. They don't care that you just lost your job or that your income fluctuates. They're just going to sell you a plan at a flat rate. If you go through the marketplace or exchange, they will take your income into account, and you can change your income in your marketplace account as the year goes on if your income fluctuates. You may also be eligible for Medicaid, depending on your situation and what state you're in. And you may be eligible for the Essential Plan. That plan is New York and Minnesota only. All right, now let's talk about these different options. So COBRA is a law that lets you keep your employer or union-based coverage for 18 months and sometimes longer, sometimes up to 36 months. You have 60 days from the loss of your job coverage to choose COBRA. The deal with COBRA is that it's good in that it allows you to keep the coverage that you had, so you have no interruption in your coverage and you have no interruption in your providers, right? So it allows for what's called continuity of care. However, you're paying the full cost of your health insurance and it's often very expensive. So for one person, COBRA can be easily at least $500 to $1,000 a month or more. That totally depends on what kind of plan your employer or union has, but it can be quite expensive. Contact your employer or your union's HR, pension, and health department for more information on your costs and to enroll. So they're the ones that would enroll you in COBRA. COBRA may make sense for you if you're currently going through very expensive treatment and you don't want to switch providers, or you know that your costs will be more than your COBRA premium every month. So you can also enroll in insurance through the marketplace or directly through an insurer. And this is something that a lot of people don't understand. There is something called an open enrollment period that applies to plans both on and off the marketplace. In other words, plans sold through the marketplace as well as plans sold directly through insurance companies. In most states, there's one time of year to enroll. It's from November 1st to December 15th of every year. In New York and California, I say approximately November 1st because California has in the past started around October 15th. But New York is November 1st to January 31st of every year. So states are doing it a little bit differently. It does pay to check your state and see when open enrollment is in your state, but it's most likely November 1st to December 15th. That means that you can choose a plan during this time and this time only, unless you meet the criteria for a special enrollment period, which we're going to talk about in a second. Now, because of COVID, some states have opened up a COVID-related open enrollment period. New York is currently in one, so it's August, and our COVID-related open enrollment period ends August 15th, but may be extended, we'll see. And California also has one right now. So check your marketplace and see if in your state they're doing a COVID-related open enrollment period. This is healthcare.gov. You can see in the upper left-hand corner, healthcare.gov is the federal website. It will direct you to your state website. So if your state doesn't use healthcare.gov, most states do, but if yours doesn't, it will direct you to the appropriate website. So for example, if you're in California, it'll direct you to coveredca.com. And you can see here that there's several different buttons. You can see if you can currently enroll. You can get information on various topics. If you typed in preventive screenings in that search bar, you would get a list of all of the preventive screenings that are covered for free. So it's kind of a one-stop shop. What's a special enrollment period? So if you don't sign up during open enrollment, you have 60 days to enroll if any of these things happen. You lose your union or employer coverage, or your COBRA coverage ends. You get married or divorced. In some states, you can be pregnant and get a special enrollment period. In other states, you actually have to have had a baby. Having the baby constitutes the beginning of the 60-day open enrollment period, special enrollment period. You can also get a special enrollment period if you've adopted a child. If you move to another state or county where the options are different, so this is not just moving down the street, this is actually moving somewhere where the options are different. If you have a change in your immigration status, maybe you're getting a green card or different visa status. And if you're aging off your parents' coverage at age 26. All of these will generate what's called a special enrollment period of 60 days outside of open enrollment when you can apply. There are a few other exceptions to open enrollment because, you know, there always are. You can apply at any time of year if you're eligible for Medicaid or the Essential Plan. If you're putting a child on Child Health Plus, or what's called the Child Health Insurance Program nationally, or if you're buying insurance for a small business. So who helps you enroll? We do. We want you to come to us. Us is the Artist Health Insurance Resource Center on the East Coast and Entertainment Health Insurance Solutions on the West Coast. And you can see our phone numbers here and our email address. So we help everybody in performing arts and entertainment understand their options and enroll in insurance. Our services are free, they're very comprehensive, and we are unbiased. So if you're having trouble doing it on your own or you have questions, please don't hesitate to contact us. So a lot of people have come to us saying, how do I lower my premiums because I am no longer making what I used to make, right? You can lower your premium costs if you bought a plan through the marketplace, either healthcare.gov or your state marketplace, or if you think you're eligible for Medicaid. You cannot lower your premiums if you bought a plan directly from an insurance company, unless you have magical powers. All right, so let's talk about how you calculate your income. There's two ways to do it, and you're going to do whichever way is most beneficial for you. So if you have a marketplace account, you're going to go into your account, or if you're newly eligible because you're losing coverage through your job or your union or whatever, and you're in the market for health insurance, you're going to go into and create your marketplace account or go into your account and estimate your 2020 modified adjusted gross income. Okay, that's what they want to know. What's your modified adjusted gross income? What that is your adjusted gross income plus a few other things thrown in. And your adjusted gross income is listed on line 7 of your 2018 tax return or line 8B of your 2019 tax return. Okay, so you can use your most recent tax return to estimate your 2020 income if you think that it's within about 10 or 15% of that, right? So if you look at 2019 and you say, you know what, this year is going to be within about 10 or 15% of that, then it makes sense to use that number as your estimate for your income in 2020. You're going to add to that any non-taxable Social Security benefits, tax-exempt interest, capital gains, dividends, or foreign earned income. All right, so that's one way to do it. Whoops. Sorry. The other way to do it is the way that probably most people are going to be doing it now. A lot of people in our industry lost their jobs in March, and they qualified for unemployment eventually, right? And so what do you do in that situation? Well, you're going to add up all of your income, basically, for this year. So any W-2 income that you got up until that job ended, you're going to write that down. That has to be gross. That means pre-taxes. If you have any self-employed income, you're going to write that down, but that can be net. That means you can deduct business expenses from that. Any other sources of income that would normally go on your tax return, like interest, dividends, rental income, residuals, you need to add those in as well. That's also gross. And then your unemployment benefits. Now, for your unemployment benefits, you're going to take your gross weekly benefit and multiply it by however many weeks you're going to get it this year. So if you started getting your unemployment benefits on April 1st, then you are going to multiply your gross weekly benefit for the weeks from April 1st through December 31st, right? So you're going to come up with a total number of unemployment benefits for the year. Now, this is how somebody who has lost their income and is due to the pandemic and is currently on unemployment would estimate their income. If you have started to work again, right? Maybe your W-2 job has called you back. You're going to have to put in your income for the year from that job. And if you've started to do some self-employed work, maybe you are doing voice lessons over Zoom or something like that, you're also going to have to put that income in for the year, right? So what they want is your 2020 income estimate. You're not going to put in anything that you don't know you're going to get. In other words, if you are thinking, you know what, in September, I think things are going to start up again, and I think I'm going to get that gig again. If you don't have a contract, and this is just sort of you hoping that you're going to get that job, do not put it in. You're going to put in only things that you either have gotten or know you're going to get. What about pandemic payments? You are going to not have to worry about the $1,200 stimulus check. You also don't have to worry about cash gifts up to $14,000. They are always excluded from your tax return. So you don't have to add those things in. And this is where it gets a little tricky. What about that $600 a week that you were getting, right? What do you do with that? Well, if your income is above $17,609 in states that have expanded Medicaid, and we'll get to those states in a second, then you have to include the extra $600 a week that you got. In New York, you have to include the extra $600 a week if your income is above the essential plan threshold, which is $25,520. So let me just repeat that. It's kind of an if-then scenario. If your income in most states is above $17,609, then you do add in the extra $600 a week for however many weeks that you got it. In New York, you add in the $600 a week if your income was above $25,520. All right? If it's below those numbers, you do not have to add that extra $600 a week in. So what is Medicaid? What is this $17,000 threshold? Why does it exist? Medicaid is a comprehensive health insurance program, and it includes all essential benefits. There's almost no cost to patients. There are no monthly premiums, there are no deductibles, and the copays are very, very small, and they're generally for medications. Coverage generally lasts for 12 months. If your income increases and goes over the Medicaid threshold, you may be able to stay on Medicaid. So for example, in New York, if your income goes over the Medicaid threshold, then you let the marketplace know, and they will send you a very confusing letter that says, thanks for letting us know. You're no longer eligible, but you're going to stay on it for the full 12 months. If you are eligible for Medicaid, get on Medicaid. It's extremely comprehensive. Financially, you can't do better than Medicaid, right? Now, the issue is some states have expanded Medicaid and some states have not. So here you can see the blue states are the states that have expanded Medicaid. That means that in those states, your income has to be below roughly $17,000 a year in order for you to qualify for Medicaid. In the orange states, it's much more complicated. Okay, so in the orange states, there are a lot more hurdles to being eligible for Medicaid. So check out the map and see if your state is blue or orange. So the people that live in states that have expanded Medicaid have two ways of being eligible for it. Your income, your annual income, should be under $17,609 as a single person, or $23,792 for two people. However, you can also do a monthly eligibility application. So if your income in the prior month was below the monthly income limit, which is $1,468 for one person, or $1,983 for two people, then you're also eligible for Medicaid, even if your income in the other months was higher. So Medicaid is the only program that lets you be eligible based on your current or prior month's income, right? And that's a really good thing. A lot of people got onto Medicaid at the beginning of this pandemic when they weren't getting their unemployment benefits yet. And their income, they had no income. So it was definitely below those monthly limits. And a lot of people got onto Medicaid. So if you're in a situation where you have no income, or your income is below the monthly Medicaid income limit in a state that expanded Medicaid, then you're eligible, even if you made more money in the prior months. Again, if you are Medicaid eligible, if your income falls below the threshold, do not include the $600 a week pandemic payment as income. Who is eligible in states that didn't expand Medicaid? So you can see the states that didn't expand Medicaid here on the screen, right? Alabama, Florida, Georgia, Kansas, Missouri, Mississippi, Oklahoma, North Carolina, South Carolina, South Dakota, Tennessee, Texas, Wisconsin, and Wyoming. In these states, unfortunately, it's very difficult to get Medicaid. I would complain to your elected officials. Here's the link for how to find your elected officials. I like this link in particular because as soon as you put your address in, it not only tells you who your senators and Congress people are, it also tells you who your local elected officials are, which can be very important. So check that out. So in those states that didn't expand Medicaid, if you're under 65, you have to be very low income, be a U.S. citizen or legally present resident of the state, and be either pregnant, disabled or blind, parent, caregiver of a child, or a child under age 19. All right, what is the essential plan? So essential plan, it says New York only here, but it also exists in Minnesota as Minnesota Care. It's slightly different there. I'm going to talk about the New York plan here. So the essential plan is comprehensive health insurance. The premium is $20 a month. There are no deductibles and copays are very low. So $15 to see your primary care physician, $25 for a specialist. The income limit for one person is $25,520, and for two people, it's $34,480. So that's your annual income limit. Eligibility is based on the annual income estimate, not like with Medicaid on a prior month or current month. You have to be between 19 and 64 years old and meet certain income and immigration guidelines. And coverage lasts up to 12 months, but not the full 12 months. So if your income goes over those limits, you let the marketplace know, they're going to say, okay, thank you very much. And now you have to go and find a different plan, right? They're not going to penalize you, but they are going to ask you to move off of that plan. They're going to give you some time to find a different plan. What benefits must be covered by all these plans that we're talking about? So what you see here on the screen, hospitalization, physical therapy, office visits, medications, the emergency department, diagnostic and lab work, ambulance, x-rays and imaging, mental health treatment, preventive screenings that we discussed earlier, substance abuse treatment, and maternity care. These all have to be covered, right? If you are on a marketplace plan or if you're on the essential plan. And in states with expanded Medicaid, these are all covered services. So insurance has to be comprehensive. You can no longer have insurance that will just cover your arms and your legs, which is actually a real scenario I had. So what if you don't qualify for Medicaid or the essential plan? Well, anybody's eligible to buy a qualified health plan through the marketplace. The costs vary greatly. So it really depends on your county, your household size, the level of coverage that you get, the insurance company that you want to go with. We cannot tell you, yes, everybody can get a $50 a month plan. It just doesn't work like that. So you really have to kind of drill down and figure out your own personal financial situation, and then you can figure out what your costs are going to be. So if your annual income is below $51,000, you're going to get a subsidy to buy insurance on the marketplace. For two people, your income has to be below roughly $69,000. So in those scenarios, you're going to get money to buy insurance. They're going to offset the cost of your insurance with an advanced premium tax credit. How do you figure out your advanced premium tax credit? What you're seeing here is the New York calculator. There's also a calculator on healthcare.gov, but it's a little bit more hidden. So you have to go through the process of, you have to click on the button that says, look at plans and costs. And then they ask you some questions. How old are you? What's your zip code? How many people are in your household, etc. And then they'll show you what your advanced premium tax credit is going to be. But essentially, all of these calculators do the same thing. They want to know your county. They want to know the number of members in your household. And by the way, your household is anybody you file taxes with. It's not roommates. It's not domestic partners. It's spouses, children, and sometimes dependent parents. They're going to want to know how many people are needing coverage. They're going to want to know if there are any kids under the age of 19 in the household. And then they're going to want to know your total household estimate for the year. And you can see here that I've estimated a plan for one person who's making $32,000 a year. And they're going to get a monthly subsidy of $393.21. That's their monthly subsidy. That's how much their costs are going to go down every month, right? That subsidy can be applied to any level of coverage, bronze, silver, gold, or platinum. This is just an example. So not every county is going to have the same subsidy. Some counties might have more of a subsidy in this scenario, and some counties might have less. How do you pick a plan? So a lot of people come to me and say, just give me the name of a good insurance company. And I say to them, there are no good insurance companies. They all want to make money off of you. That's their job. So what you need to look at is a few things. You need to think about how you use the healthcare system. You need to think about your budget. And you need to think about what your doctors are in network with. So in terms of using the healthcare system, think about whether you take any medications or not. Think about whether you're pregnant or will need knee surgery in the near future or are going through cancer treatment. All of these things would tell me that you need a higher level of coverage, right? Or are you somebody who, for example, never uses the healthcare system and you just want to make sure that in case of an emergency, if something horrible happens, you have a limit on how much you're going to owe, right? You're not going to owe $250,000 for surgery. You're only going to owe the out-of-pocket maximum, perhaps, right? That's a very different scenario. That tells me you're going to want a lower level of coverage. What's your budget? What are your doctors in network with? It's very important when you call your doctors to find that out, that you not ask them what insurance do you accept, but you drill down and say, what are you in network with on the marketplace? Because a lot of companies have different networks. So for example, Blue Cross Blue Shield has many, many different networks. The network for SAG-AFTRA members is totally different than the network that might be on the California marketplace or the New York marketplace. So you want to specify that you're trying to figure out what they're in network with on the marketplace. If you think you're eligible for Medicaid or the Essential Plan, you're going to ask them, are you in network with any Medicaid or Essential Plans? And then of course you're going to think about what benefits you're eligible for, right? What your subsidy is going to be if that's something that you're eligible for. Name brand is not better. You might end up going with a company that you haven't heard of before, and that's okay, as long as it meets your financial and healthcare needs. So there are different levels of coverage: platinum, gold, silver, and bronze. Not every county has every level of coverage. So some counties do not have the platinum level of coverage. But basically, platinum is the highest level. It's going to cost you more every month, but your costs are going to be much less when you go to the doctor. So your monthly premium is more, but maybe you don't have a deductible at all. And maybe your copays are very low when you go see the doctor. Bronze is the exact opposite. Your monthly premiums are going to be much lower, but you could have a huge deductible, or you might have very high copays or co-insurance. And silver and gold are kind of in the middle, right? So with silver, maybe you're somebody that goes a few times a year because you have some sort of issue, and maybe you take some medications, and maybe you need lab work. You just want to be able to make use of the healthcare system in a kind of general way. You're not foreign to it. You maybe need it on a regular basis, but perhaps nothing major is going on. Silver might be the right level for you, or maybe it's a step up at the gold level. So the gold level usually has lower deductibles than the silver. How do you get the most bang for your buck? So you're going to want to look at what you make use of. Do you need to see a specialist on a regular basis? Does that mean lab work? Do you need medications? Then you're going to want those things to not be subject to a deductible. So you do have to look at that summary of benefits, right? You got to look at that and look at those categories and see, does it say that they'll pay only after I've satisfied the deductible? And if so, what's the deductible, right? The best deal is that these services are covered at a copay pre-deductible. So that's what you're going to want to look at when you're looking at plans for the most part. Of course, you're also always going to want to find out, if your doctors are in network with those plans. But this is just in terms of getting the most bang for your buck. Now there's a buyer beware here. So the current administration allowed short-term plans and faith-based share plans to kind of skirt the rules that we talked about. So these plans don't have to play by the regulations that we talked about at the beginning of this presentation. They can charge you more based on your health status. There's no cap on what you pay. They don't have to cover some of these benefits. They don't have to cover pre-existing conditions. And they can retroactively cancel your coverage if you get sick. How do you figure out if you are being solicited by a short-term plan or a faith-based plan? A lot of these will require some kind of membership or fees for initiation or one-time registration. That's pretty common among faith-based plans. Also, promises that sound a little bit suspicious. You can see it any provider anywhere. Really? That seems a little, I don't know. If it says the phrase not major medical, it's generally not health insurance. And if they say discounts of up to a certain amount, right? So if it's a plan that says we can discount your hospitalization up to 40%, I would be very suspicious of that. Essentially, what you're going to want to do is either contact us if you get solicited by one of these plans, or go to healthcare.gov or NAIC.org. That's the National Association of Insurance Commissioners. Those are places where you can find regulated plans and you can find information on insurance companies that are licensed to sell insurance in your state. All right. I would be particularly careful with short-term plans. We do see people getting on faith-based plans, but they're generally pretty upfront about what they don't cover and that you need to follow certain religious lifestyles. I would say that they tend to pray for you, but they may not pay for you. With short-term plans, those are sold by big insurance companies, and oftentimes people don't realize that it's a short-term plan, and it will say, you know, we cover hospitalization, and then you look in the fine print and they only cover hospitalization on Tuesdays and Wednesdays. And that's not a joke. That was in a policy that I saw. So you want to be very careful with these plans. If they're not sold through healthcare.gov, then please contact us and we can take a look at the plan and see if it's would make sense for you or if it's a junk insurance plan. What if you're uninsured? Right? So what if all else fails and you're uninsured for a period of time and you need hospital services? You're going to go to the website essentialhospitals.org and click on our members, and you'll see there all the hospitals across the country that have to see people who are uninsured at a sliding scale, which means they charge you less based on your income. If you're just looking for regular outpatient care, you can find free or sliding scale clinics at findahealthcenter.hrsa.gov. So they will list all of the health centers in your zip code where they will see you based on a sliding scale. You can get help paying for prescription drugs at Needy Meds, which is a really wonderful website. And FYI, they also list sliding scale clinics all across the country. But what Needy Meds does is it is a database for pharmaceutical assistance programs. So drug companies give their drugs away for free to people who meet certain income guidelines and are uninsured. And you can find those programs at needymeds.org. So if you type in the name of your medication in the upper left-hand corner there, it's going to bring up the manufacturer of that medication and the application that you need to give to your doctor. The doctor has to sign off on it, and then you send that into the pharmaceutical company and you could be getting your medications for free. Most of these programs have income limits, and most of them require that you're uninsured, but not all. Some of the programs through the pharmaceutical companies allow people who are insured to get the medications as well. So it definitely pays to check out that website. And finally, you can compare drug prices at Goodrx.com. This is for people who are insured and uninsured. I would recommend doing this. We don't generally recommend .com websites, but this is also recommended by Consumer Reports. And what it does is it compares the costs of your medication at different pharmacies in your area. So you can see that, for example, at Walgreens, it's, you know, $200 cheaper or $200 more expensive than at CVS. They might be one company at this point, I don't know, but it's comparing all of the different pharmacies in your area and what the drug costs are. And you will be really surprised because drug costs vary greatly. It's the same drug, but it could be a totally different price at a different pharmacy. You can also print out discount coupons there. All right, and then finally, just a brief word about COVID-19 testing and treatment costs. So the Families First Coronavirus Response Act makes testing and associated office visits free for everybody, regardless of whether you're insured or not. You can go to this website that you see on the screen and find your local COVID testing site, right? Some cities have created their own as well. New York has created its own site. This is a site basically through the CDC. It's hhs.gov/coronavirus/community-based testing sites. So you could type in your state or your county and get information on where you can go to get a COVID test. The administration has promised to cover all hospital costs for treatment for the uninsured. So if you are uninsured and you end up in the hospital with COVID-19, current administration has said that they will cover those costs. If you're insured, then treatment costs are covered according to the terms of your insurance. So any kind of cost sharing that you have or deductibles that you have generally apply. Now, some plans have waived these costs, so it does pay to call your insurance company and ask them if they've waived the treatment costs for COVID-19 cases. And that is it. If you want more information, please visit our YouTube cartoons. We have quite a few cartoons there on different health insurance topics, like how to find dental care at a discounted rate, how to lower the cost of your medications. There's a Medicare video there, and they're all short. They're 3 minutes long. We have a monthly health insurance blog called HQ that you can access at the actorsfund.org website. And you can also check out all the other webinars at the Actors Fund at actorsfund.org/workshops. Okay. Thank you so much for listening today, and good luck.